My name is Skylar Gregory, and I'm going to be promoting this health promotion video about urinary tract infections. So, to start out this video, I'm going to simply explain the urinary system. The urinary system includes your bladder, urethra, your kidneys, and your ureters. And a urinary tract infection is commonly called a UTI. A UTI is an infection in your urinary system. So, like I said, you could have a infection anywhere in your urinary system, which would include your bladder, kidneys, ureters, and urethra. So, the etiology of this disease is that there are two main types of bacteria located in these infections that are commonly found within the women under the age of 50. So, 80% of all cases of UTIs have the same two bacterial infections. So, the pathophysiology of this disease is that urinary tract infections are caused by bacterium that invade the urinary epithelium cells, causing irritation and inflammation of these cells. The infection can start in the urethra and can progress its way up to the bladder, ureters, or even your kidneys. Infection of the urethra or bladder is known as a lower urinary tract infection, while infection of the ureters, renal, pelvis, or kidney tissue constitutes as an upper tract infection. Women tend to be more prone to urinary tract infections due to their anatomy. Their urethra is shorter than a man's urethra, and thus bacteria can reach the bladder more easily. In addition, a woman's urethral opening is located closer to the anus, making it easier for bacteria to migrate from the anus to the urethra. So, this bacteria is going to have a shorter distance to travel on a woman than it would a male, making it predominantly likely for women to have urinary tract infections. So, some clinical manifestations of a urinary tract infection is that you're going to have a strong and persistent urge to urinate. You're also going to have a burning sensation when urinating, and you're going to void very frequently, and you're also going to void very small amounts of urine every time you void frequently. So, if you're not drinking a lot of water, you're going to keep just voiding very small amounts of urine. Your urine could also appear very cloudy, or your urine could appear red or brown. Sometimes they say that it could often mimic the color of like Dr. Pepper or a dark Coke kind of product. You could also experience pelvic pain with urinary tract infections. So, how the doctors diagnose this? The diagnostics are they analyze a sample of your urine. So, you'll go into your doctor if you're having some issues. You will provide them with a urine sample, and they will test that urine sample for you and be able to tell you whether they think that you have an infection in your urinary system or not. So, another one would be a lab analysis of your urinary tract bacteria. So, it's when they actually take your urinary sample and send it off to the labs to get it further tested to just confirm that that bacteria is actually the bacteria that they use to diagnose the urinary tract infection with. So they could also do a CT scan or an MRI of the urinary tract system, and they do that just to see. They take pictures of your urinary tract infection system, so that they can see if there's any spots where you may show infection or not. So, or they will do a cystoscopy inside of the bladder and the urethra, which is when they take a tube that has a camera and they go up through your urethra and they look around to examine, and they pull parts of they swab parts of your urethra and bladder and they test those. So all of these testings will determine when the severity of your condition and how far the infection has progressed. So it's really going to be up to your doctor which one of these diagnostic testings they are going to have you do. And some complications of this disease would be permanent kidney damage. You could have urethral narrowing in men. You could become sepsis. Or in pregnant women, there has been shown that if you have a urinary tract infection and some complications because of it, you may have premature labor or give a low birth weight when laboring to your baby. So, some risk factors that are going to be at risk to get a urinary tract infection is the female anatomy, because as I explained earlier how the urethra is so close to the anus, it's very likely to get that bacteria into your urethra. And another one is going to be sexual activity, because you're having so much new bacteria introduced to that area. Certain types of birth control can throw off balances in hormones and pH levels, and that can cause you to be more susceptible for bacteria to enter. Menopause can be a reason. If you have any urinary tract abnormalities that aren't normal in your urinary tract system, it could be anything that you were born with, or maybe if you had a procedure done, or if you had trauma to your urinary tract area, anything like that. If you have blockages in your urinary tract, this can also make you susceptible for urinary tract infections. Or when you have a catheter in you, this also makes you more susceptible to bacteria entering your urethra and causing a urinary tract infection. So, they always want to treat a UTI with antibiotic drugs. The most common antibiotics used are going to be Bactrim, Septra, Monourol, Macrobid, Keflex, and ceftriaxone. So they're going to want to use those antibiotic drugs to treat the UTI, but to prevent the UTI, you're going to want to always drink lots and lots and lots of fluids, especially water. Another good prevention method is to drink cranberry juice. And you want to always wipe front to back after voiding or urinating. You always want to wipe from the urethra to the anus, never the anus to the urethra. You're going to want to void immediately after intercourse. So after intercourse, you're going to want to void as soon as you can afterwards, and that's going to help expel any bacteria that may have been introduced to your urethra at that time. And lastly, you're going to want to avoid products that could irritate that area. So any kind of sprays, wipes, feminine products that could cause an irritation to that area could be harmful and introduce any bacteria or let in anything that shouldn't go into your urethra. So some references that I used, the first one is the urinary tract infection. It's from the Mayo Clinic. I used another one That is the urinary tract infections in women, etiology and treatment options from NCBI. Then I used the pathophysiology of a UTI from OSU. And then I used the picture in my PowerPoint. Referenced that, and that is from a revision from Merck Manuals. So thank you.